My name is Stephanie Stern. I'm the program director of Direct Hope Connections for Cancer Support. And I'm really happy to be here today with Craig Lustig and Dana Dayton to talk about a really important topic, resiliency. Hope Connections is committed to helping people gain resiliency through our support groups, mind body classes, and educational programs. Dana, Craig, and I will be discussing actually many definitions of resiliency. An ability to recover from or adjust easily to misfortune or change. And Dana, thank you.
Well, thank you, Stephanie and Craig, for having me. Thank you, everybody. I know, many of you are going through a rough time, and I understand. My name is Dana Dayton, and I am an esophageal cancer survivor, stage 4, and I'm one of the few. And I know how lucky I am every day. I was diagnosed when I was 43, which is pretty young. Women are not normally diagnosed with esophageal cancer at all, much less at such a young age. So I was really outside of the box for pretty much all of the conventional wisdom that existed, and there wasn't even that much. So I really had to fight tooth and nail to, find pathways. And I was very lucky. Most of the people that, were on the journey with me as patients are not here today. So I'm grateful to have this opportunity and happy to share.
Thank you, Dana. And Craig, you introduce yourself?
Sure. So I'm Craig Lustig, and I am the Associate Director of the Rouge Center. So Sean's my boss, and we've been together for 10 years, and calls me his work husband, and we bicker a lot. But maybe for purposes of this conversation, I'm actually not a GI cancer survivor, but I'm a 30-year survivor of brain cancer. And even though you thought I look like what 30, it's actually diagnosed at age 27, and coming up on April Fool's Day of next year is 30 years to the date since I completed my treatment. So I'm doing a lot of good things to sort of reflect on this and share what little tidbits I can about my journey.
And Dana, we were talking prior to this, just preparing for this. And Dana, you started to share what really helped you through your cancer diagnosis and what you feel like helps you through it. So maybe you could share that here. I think it would be really helpful.
Sure. So as I mentioned, I was diagnosed when I was 23, and it was after a year or two of just feeling unwell, but I couldn't put my finger on what it was. Thought it was lupus for a long time, and that was bad enough. Who wants lupus? I had severe joint pain and other types of discomfort, and things just sort of cascaded. And all of a sudden, I discovered a node in my neck. And once that was biopsied, it still wasn't clear. We knew there was cancer somewhere, but it didn't point to what type of cancer. And so I was on this long diagnostic journey. Because again, nobody suspected esophageal cancer for a 43-year-old woman. And that's where I was like, no, this can't be happening. I've got 3 kids. They were 8 and 12. I cannot leave this planet because my husband cannot find the checkbook. So I have to leave. And I just was on this like crusade to figure it out. And so as I was telling Stephanie, my MO was to tell everybody, even when I didn't know what it was. I told them like what biopsies I had and what tests I had had. I told everybody because I felt like I was kind of distributing the worry a little bit and hopefully expanding the universe of ideas that come back in. And sure enough, I did get a diagnosis, and that was all through science, not through sharing my story really. But the reason I lead up to this is because I was bouncing around from different institution to different institution, not getting very good prognoses. They basically all said, get your affairs in order, enjoy your kids for a few months. And that was it. And then there was one day where I told a former colleague and good friend of mine, I said, Lori, who is from this area, by the way, I said, Lori, I have esophageal cancer, it's stage 4. And she said, oh my God, Dana. And she was like, hold on. We have a good friend and family that had the same thing. She's like, let me call her right now. So she hops on the phone. Lori and I are still talking. Lori, maybe she was texting. She texted her friend Carol, who was like, oh my God, hold on, hold on. She texted her physician, and I kid you not, within 10 minutes of telling Lori, that physician called me and he said, hi Dana, I'm Dr. So-and-so, how can I help you? And honestly, he was the magic in my situation. And he really was able to look under every rock and look outside of every box. He recognized that I wasn't in the normal, group of people that usually get this disease, and he was willing to try things that the other people weren't. They all had good reason for not, but I think for me, I knew that I had to convince people that I was different than the rest of the patients, because I wasn't the 65-year-old, smoker or fast eater or, other like alcohol drinker. I wasn't any of those, and therefore I thought I had a little bit more of a chance. So I just continued to tell people, I continued to network, and I found places like the Hope Center. I found other groups like In-Home Angels and many other support groups. I participated in as many as I could. And now I actually am part of as many as I can be. So I really do believe in that power of connection. It saved my life, and I'm convinced it will do wonders for you.
Well, thank you, Dana, so much for sharing that, because I think for so many of us, we want to go inward when we're diagnosed with cancer. We don't want to be seen as different or pitied or all the things. So for many of us, we don't always want to share with everybody. And I just thought when you had said that you would tell everybody and anybody, so that you never know who knows someone, who knows something, and connections really do help us emotionally, and help us physically and spiritually and all of those things. So thank you so much for sharing that. And Craig, how about you?
So maybe sort of reflecting on what Pam was saying, and so I was diagnosed at age 27. Brain tumors are exceedingly rare as a group, and then there are different categories within that. And so the tumor I had was, I don't know, 300 or 400 new cases a year in the United States. So very, very, very small patient population. I was living in New York at the time and had sort of through a very lucky chain of events, went from my internist to helping get to the initial diagnosis. At the time, my symptoms were pituitary gland, the master gland that's like there. I started having pituitary issues and quickly got to surgery, and then I had to make some decisions about what I would do next, because I would need additional treatment. I ultimately found one location in the entire United States where they had a clinical trial attempting to use chemotherapy in my case and not radiate my brain, which would have left me with significant deficits. And so I went to Memorial Sloan Kettering down the street from Mount Sinai Hospital where I had my surgery. Well, part of this very, very small trial, maybe about a dozen of patients on this, and we could go through about 6 months of outpatient chemotherapy, and the tumors melt away. And then 10 months later, it all comes back. Right? When I went through, I think my point in all of this is about where I found my voice. And I think that's really important for all of us, especially when we're dealing with cancers where this is not a sprint, this may very well be a marathon. I think when I was initially diagnosed, it's sort of like you've been hit by a bus, right? And so you have to take in all of this information. You're listening to all these physicians, you're trying, my parents are in the background, everyone is telling you what to do. And I did my best to just sort of listen and do what everyone told me that first round, if you will. I think when I had my relapse, when I was diagnosed again, I decided that I needed to take charge. Even in a state where my health was very compromised, but that I didn't know what my outcome was going to be. But if I didn't have a voice, if I didn't take ownership of the decisions about what treatment I was going to get and how I was going to get it and how much more I was going to do, I couldn't feel, I don't know what the word is, comfortable with my own existence at that point. So for me, finding my voice and not being difficult, if you will, but ensuring that I had input into what was going to happen in the next steps was really vitally important. And I think it's something that has helped me be well beyond my cancer experience, which is making sure that everyone's well intentioned, right? Whether it's your family or your healthcare providers, but ultimately you're the one living with this. In my case, 30 years of not having pituitary function, or whatever, however we are all here, and whatever cancer we may be living with, and whatever side effects from either the disease or the treatment. I think that this idea of ensuring that your voice is central to the conversation is just really important. Yeah.
And also too about, I think resiliency really shows in just how you're doing, how you're feeling, and again, making connections with people and being able to share. For some people, they want to share with everybody, like Dana, which is amazing. For other people, maybe they only want to share with a few people, and that's so individual. Yes, we will in a minute. Yes, no, questions are good. But I just want to share in terms of Hope Connections and how much, how many programs we have, how many services there are here. Everything is free of cost, and having a place to share. I always say the good, the bad, and the ugly with people who understand is so important. So I hope that all of you will take advantage, of Hope Connections, whether it's in person or virtual. And absolutely, thank you for having a question.
On the Sloan Kettering thing, chemo experiment, you said worked and then it came back.
Right.
What eventually led to your 30 years of additional life?
Right, so this was an interesting study. There were no new drugs, right? They were using old chemotherapy agents, but the idea again was to avoid radiating the brain, right? Because the experience was you could get rid of this tumor type, right? But it was going to leave people in a very bad state. So they then proposed that they give me a different kind of chemo, even worse than the first three I got. And they were going to then follow that with what they call the low dose boost of radiation. So a low dose of radiation to the area where I had the recurrence. Okay, and that was the insurance policy, if you will. We knew radiation worked to get rid of these tumors, but you don't want to use it if you don't have to. So do the first line, the front line was chemo, followed by the low dose of radiation. And in full disclosure, part of the challenge I had is that when I recurred, the point of the recurrence was not back here at the pituitary, the pineal, it was actually between the tentacles of the brain, and they thought that I might have tumor tissue in my spinal fluid. And so they irradiated not just my brain at a low dose, they radiated my spinal column. And I was left with, and have been for a long time, and adjusted over the years, a lot of pretty significant GI symptoms because of that treatment. But that's ultimately what, not what that's why I'm here 30 years out.
I would grasp onto any hope I could find. And what I found is that allowed me to get to the next day. That's all I want to do is get to the next day, because when you have such a dire diagnosis, you really can't look much more forward than that. So I was able to look to the next day and look to the next day, and I pulled little threads of hope, and I exercised and I got dressed every day. And if I couldn't take a long walk, I would take a short walk. And if I couldn't take a short walk, I'd unload the dishwasher or carry the laundry up the steps. So it was really important to me to keep moving and keep my health up. And like you said, keep your nutrition up. And it was all very hard, but that did sew together a whole bunch of next days for me until, you remember my diagnosis was a little while ago. That sewed together enough days that I made it to a point where immunotherapy became a possibility for me. That was not lung cancer, but my amazing physician team had the foresight to say, you know what, let's test your microsatellite instability. And sure enough, I was microsatellite high, and that made me a possible candidate to respond better to immunotherapy. So, and this was after a recurrence I had as well. esophageal is really tricky, it comes back all the time, it does what it wants to do. And so that's why immunotherapy is so important, because it's systemic, and it trains your cells to fight back on their own versus chemo, which just kind of wipes them out. And so I was able to receive immunotherapy. For me, it was Opdivo through Compassionate Care with Bristol Myers Squibb. And I am so very grateful that my physicians had the foresight to suggest it, and I was lucky enough to receive it from the drug company, and I was on it for 3 years. And it saved my life. It was really the only reason I'm sitting here, because I had radiation surgery, countless rounds of chemo, and none of them did the trick completely. But immunotherapy seemed to kind of stop things where they were, train my own body to fight back. So I actually was willing to go through the worst of anything. I didn't want to just feel okay. I wanted to survive. And so I think things have started to change, and palliative care means a lot more than what I was told even 8 years ago. But it was a scary word then. I felt like it was like the white flag, surrender. But now I really understand it, and you do need to feel your best in order to go through the rest. So that's what I would say, like, take everybody's advice. I totally believe in acupuncture. I believe in holistic care, hypnosis, whatever it takes. It's important to take care of yourself.
Absolutely. And thank you so much for bringing the palliative care part. And I know somebody here also brought it up too, but I don't think there's a lot of misunderstandings about palliative care. Hospice care is only palliative care, but palliative care is also something that can be given with your treatments. And really, palliative care is designed to improve your quality of life. And who doesn't want their life to be improved when you're going through a cancer diagnosis, especially all the treatment side effects and even the emotional aspects too. If you are not feeling your best, please ask your doctor for referral. It is something that is so important, as everybody deserves a good quality of life.
I think there's another word that was in my head, but I think what David talked about was a lot of individual things, but I think for me, the entire thing that you described was purpose. And that's really something that I think has been really important to me. And when I talk, what I mean by purpose is that this idea that, and something that I, with my advocacy hat on, I tell patients all the time, which is just because you have a cancer diagnosis doesn't mean the rest of your life goes away. You're going to have to make changes and compromises, but you are still who you are in terms of your relationships and your community and whatever you do professionally and things like that. And I think that retaining as much of your purpose, who you are during and throughout that cancer experience, I think is part of what made me resilient. I still had friends and a family, and I did as much of my job as I could do. And those things were often challenging, but at the same time, they gave me a great deal of ability and greater strength, if you will, to then be able to go to, go to the radiation therapy, every day for 6 weeks and go through that. So I think purpose for me is an important part of resiliency.
Great point.
Yeah, and I know we have to wrap up. I always tell people the power of purpose and the power of connection, can't be underestimated. That's, like I said, what gets you to the next day.
Thank you, everybody. And I think we're going to transition now.